There is somewhere in this building a hidden bill. We don't know what's in it. A lot of the people on the other side don't know what's in it. The press doesn't know what it is. The American people do not know what's in it. President doesn't know what's in it. Nobody knows what's in it. But they're designing this bill, which is going to be represented to expand Medicaid even further.
After a year of discussions among many folks on a bipartisan basis, ending up in a very partisan bill, the fact that half of the expansion is occurring in one of the worst programs that exist in our country, locking people at 133% of poverty into Medicaid with no other choice, does not seem to me to be true health care reform.
This bill would add 15 million more Americans to the Medicaid program, which, as Senator Corker said, is like giving someone a bus ticket to a bus line that only operates half the time, because about 50% of the time, doctors won't see new Medicaid patients.
And what it will do to our health care system is literally bring it to its knees, because you're going to have this massive rush of people who have the Medicaid card in hand, and we don't have the capacity to deal with that.
So the majority of the people who are going to go under this new health care reform, what are they going to get? They're going to get the worst health care system in America, called Medicaid, a system where doctors won't participate. If the doctor's not in, it's not health care reform.
And we are putting a new burden, if we pass this legislation unamended, that's going to be a tremendous burden on our governors.
I asked my colleagues, if the Reid bill is signed into law and the Medicaid expansion is going into effect, what will the states do to make their budgets work? It would just devastate the states, as Governor Bredesen has said, and as Governor Barber has said, and almost every governor, when they think about it, will say.
There is no way that the states can deal with this except with massive tax increases or massive cuts in education.
I think that this Democrat proposal that we're looking at fails. It fails in terms of getting costs under control. It fails in terms of increasing quality or increasing access.